Starting with the lung, see, if you talk about the lung, in the lung there can be either airways or there can be parenchyma, isn't it? So when we talk about the lung, airways, so these are the airways and there is a parenchyma. There is a parenchyma. So lung parenchyma, if there is disease in the lung parenchyma, okay, if there is a disease, it is called as restrictive lung disease. Restrictive lung disease. If there is any disease in the lung parenchyma, they are called as restrictive lung disease. If there is any disease in the airway, it is called as obstructive lung disease. I will repeat this again and again. In the beginning of the lecture, why I am telling you about the clinical aspect, so that you should be programmed. You should defragment yourself that we are going to become a doctor. Of course, we are studying physiology, but those aspects, because NMC is highlighting again and again, we must know those aspects which are must for a doctor. So you are not a scholar, you are a doctor. So you must know those aspects. Now, in the airways, airways are divided into two categories. One is called as conducting zone. Conducting zone. Other is called as respiratory zone. And Weibel has divided these zones into 23. Okay. So Weibel has divided these zones into 23. Okay, they are 23 generation. Out of this, 16 generation are conducting and 7 generation are respiratory. So from trachea number 1 to terminal bronchiole, they are called as conducting zone. So they are 16 generation from trachea to terminal bronchiole. So T to T, remember T to T, trachea to terminal bronchiole, air is not participating in gas exchange. Air is not participating in the gas exchange, so it is called as conducting zone, and air in this zone is called as anatomical dead space. It is called as anatomical dead space. Anatomical dead space. Okay, because of the anatomy, this air is of no use. So it is called as anatomical dead space, which can be measured by various methods. I will tell you later on. And these 7 generation are called as respiratory zone. Why? Because gas exchange is happening. And it starts from, again your MCQ, respiratory zone start from, answer will be respiratory bronchiole. Respiratory bronchiole. And they will end in the alveoli. Alveoli. So they are 7. 16 and 7. 16 are conducting airway, 7 are respiratory.